talk about adjustment disorders. So the reason why I wanted to talk about this specific diagnosis is because it's one that we often see with residents in skilled nursing facilities, particularly those that have recently entered a skilled nursing facility, long-term care, assisted living, and they're having difficulty adjusting to their new environment. So to be diagnosed with an adjustment disorder, you have to meet the following criteria, just like any other diagnosis. So you have to have emotional or behavioral symptoms in response to an identifiable stressor. So an identifiable stressor could be unemployment, finances, a new illness that somebody is diagnosed with, death of a loved one, or like I said, moving into a new environment. This has to occur within 3 months of the onset of the stressor. So within that 3-month period, the person has to start to experience symptoms of an adjustment disorder. You have to have one or both of the following things. So marked distress that's out of proportion to the severity or intensity of the stressor. So marked distress would be that a person is just really taking this hard. Usually when a person enters a new living environment, it takes some time to adjust. But if we see that they're really, really struggling, that's when we have to really look at an adjustment disorder. There could also be significant impairment in social, occupational, or other important areas of functioning. So in social, you're not wanting to engage with people anymore. You're not taking phone calls. You're wanting to lay in bed all the time. You're not wanting to get up and go to work. It's really taking a toll on other aspects of your life. When diagnosing with an adjustment disorder, the person can't meet criteria for another mental health disorder, and it's not an exuberation of a pre-existing mental disorder. So if a person has major depressive disorder, we need to look at that first before we would consider an adjustment disorder, because it could just be the major depressive disorder worsening due to this change than necessarily an adjustment disorder. Just kind of like how a person can't be diagnosed with bipolar disorder, major depressive, or bipolar and schizophrenia, we need to see which came first, the chicken or the egg. So was it an adjustment disorder, or was it major depressive anxiety, different things like that. One of the other criteria that a person needs to meet is that the symptoms can't represent normal bereavement. So when people grieve and they go through that loss period, the symptoms, we all go through different things like that. So it can't be part of that normal cycle. And once the stressor goes away, so say you begin to work again, or you get used to your environment, or your financial situation changes, the symptoms don't persist, so it goes away, and you have an additional 6 months of that. So usually within 9 months, a year, a person experiences an adjustment disorder. You don't have an adjustment disorder for 2-3 years. If it's coming down to that and the symptoms are continuing, then the clinician really needs to look at what's going on here. They need to take a look at things again and see if the person is more major depressive disorder, bipolar disorder, different things like that, rather than the adjustment disorder. So there's different types of adjustment disorder. There is an adjustment disorder with depressed mood. So of course that's having a low mood, feeling tearful, hopeless about the future. There is an adjustment disorder with anxiety. So again, feeling nervous, worrying, separation anxiety. There's with mixed anxiety and depressed mood. So a mixture of feeling anxious and depressed. There's also with mixed disturbance of emotion and conduct. So that's anxiety and depression and disturbance of conduct. So the person is really doing things that, aren't like themselves. So maybe they're acting out, maybe they're throwing things, maybe they're hitting people, maybe there's something going on there that they normally wouldn't be doing, or they're taking part in something that's not really healthy for them. And then there's unspecified. So the reactions aren't classifiable as one of the specific subtypes of the adjustment disorder. So they don't meet the criteria for depression, anxiety, mixed, so you would just do it unspecified. So the reason why I wanted to talk about this again is because it's something that we're seeing a lot, especially now. A lot of people are facing unemployment, financial changes, different things like that. So people can be going through this adjustment period. So, like I said before, if a person is experiencing these symptoms and say it's longer than 6 months, then there could be underlying depression and anxiety, and that's what we need to look at. Something else that needs to be considered is, does the person have post-traumatic stress disorder? Is there a personality disorder? Psychological factors, what's their environment like? What's going on around them? Do they have any medical conditions that could be making it worse? So a person enters a nursing home and they, of course, have medical things going on. Are they depressed because of these medical conditions? We need to see, is it more depression or is this an adjustment that they're going through? And then how they handle stress. A lot of people do not do well with change, especially older people, it seems. It seems like younger people kind of see how things are evolving now. And my philosophy is, if you can't handle change now, you can't survive in the world. Well, a lot of people don't know how to cope with things like that. So we need to help give them those tools to handle that. So that's why I think it's really important. Always look in the DSM for the criteria whenever you're diagnosing someone, but I wanted to touch on the adjustment disorders because it's one that I often diagnose and that I see frequently. So I just wanted to talk about it a little bit.